So, as you've seen in these examples, while most people vaccinate, some groups or individuals delay or refuse vaccines. There's a vaccine hesitancy continuum. In the past, we used to think of it as pro-vaccine people and anti-vaccines. And with research, we've seen that you have a vaccine continuum. So from those who refuse all vaccines, there's a small group of people in that category, to some that delay some vaccines, to those that are hesitant but comply with the recommended schedule, to those that accept cautiously, to those that accept vaccination without questioning. The Strategic Advisory Group of Experts in Vaccine Hesitancy defined hesitancy as vaccination as a behavior based on confidence, so the level of trust in the vaccine, but also in the provider, in the process. Complacency, so a lack of perceived need for, or value for the vaccine. And convenience, so access to the vaccine, in terms of physical access, but also cost, time, access. What drives low vaccine confidence? You've seen some of these in the examples. So safety concerns due to coincidental rather than causal adverse events, uncertainty about real vaccine risks, and also if you're vaccinating children, less risk tolerance for vaccines than medicine, so vaccinating young children, babies, but also healthy people. And also vaccines have been shown to be a victim of their own success. So if you don't see the disease, you don't feel the need to vaccinate because you don't feel the risk of the disease. Also distrust, so distrust in information, distrust in providers, distrust in systems, distrust in scientific truths. This tension between the individual rights versus the wider societal rights to health, and philosophical or religious beliefs. I'm going to go through two examples, tetanus and HPV. So with the tetanus vaccine, there were concerns in 1995, and there were concerns that the tetanus vaccine was causing sterility. And the rumors were circulated in Mexico, Tanzania, Nicaragua, Philippines. So what happened was there was misinformation because previously there had been development of a contraceptive vaccine that contained tetanus toxoid. So then when this new tetanus vaccine came out, people misunderstood that it was the contraceptive vaccine. So what happened was in 1995, this Human Life International, a Catholic pro-life group, sent an email to their members in 60 countries saying that the tetanus vaccine contained this hormone, HCG, and that it was sterilizing people. And the people that received these emails listened. In the Philippines, the mayor of Manila shut down the vaccine program for, I think it was 6 months to a year, and there was a 45% drop in coverage between 1994 and 1995. The next mayor reinstated the vaccine into the program. And more recently, there's been concerns in Kenya around, the same concerns have popped up again. So why have they popped up again? Well, they held a press statement, the Catholic bishops in Kenya, and their main concerns were inadequate stakeholder engagement. With other public health programs, the Catholic bishops are involved, and with the new immunization program, the campaign, they weren't involved. So they were going, wait a minute, why are we not involved in this? Limited public awareness. There was some new campaigns vaccinating a lot of women of childbearing age, and so they're questioned, why does the campaign target women of 14 to 49 years? Is there a tetanus crisis on these women in Kenya? And why is it not being declared? Like, why all of a sudden are we doing this? And with all these other competing priorities, these other diseases, why are we focusing on tetanus now? So lack of public information, lack of involvement. And they got, this idea was also found on the internet. That's the issue of the internet, is concerns are sticky. So concerns from the past can be brought up very quickly. People can group on the internet that couldn't necessarily group before, find concern. If you want to find a concern, you can find it on the internet if you search for it. In terms of HPV vaccine, I'm going to highlight a case study in Japan. So this is a human papillomavirus vaccine that's primary aim is to reduce cervical cancer. And what happened in Japan in 2013 was that there were concerns around side effects, convulsions, seizures, headaches, partial paralysis. And what happened is some mothers posted videos of their teenage daughters having these side effects on YouTube. That's a very powerful thing to watch, and saying the vaccine caused it. So what they did in Japan, the Japanese Ministry of Health, Labour and Welfare decided in June 2013 to stop recommending the vaccination. The issue with this is that there was one-sided media coverage. So there were people who were concerned in the media, but not doctors, not the government, saying, actually, the vaccine is safe, the benefits outweigh the risks. They did a study to check on the safety. HPV is one of the most, the vaccine is one of the most studied vaccines, and it's seen to be safe. And compensation was agreed for one family. So that kind of, from a public's point of view, if they see that a family got compensation, well, doesn't it mean that the vaccine caused it? And so vaccination coverage went from above 75% to less than 1% as a result of this. And I was supposed to go talk in Japan, and I was told it's too political. There's no point going. Don't go and talk about this issue. And it's still ongoing. We did a study looking at media analysis, looking at the concerns online around the HPV concerns in Japan. And what this shows is the solid lines are countries talking about what's happening in Japan, and then the big dotted lines are other country, Japan talking about what happened. So in Colombia, there was mass fainting of teenage girls following vaccination. In the US, there were concerns about promiscuity, and also the governor of Texas tried to mandate HPV vaccination, so that kind of backfired. But basically what we're showing here, and the Japanese delegates were surprised, was how much other people are talking about them. They thought they had an issue, but they thought it was their issue. And then they see how many people are talking about what's going on. And also, it's the vaccine-critical sites that are applauding and saying, why doesn't our government do what Japan's doing, rather than the scientists and the vaccine experts? And then also, you can't have a talk about this without Trump and Wakefield. So here they've had a meeting recently, and so the MMR vaccine critical people are quite happy about this meeting. So Trump tweeted in 2014, healthy young child goes to doctor, gets pumped with massive shot of many vaccines, doesn't feel good and changes, autism, many such cases. So that's not great. What can you do about it? WHO have created a guide on, it's called Tailoring Immunization Programs, and this is based for the Euro region, and they're expanding to Africa region. There's going to be a new guide. So this is a diagnostic tool, and it states what we believe at the Vaccine Confidence Project is you need to firstly identify the susceptible population groups, so those that are susceptible of the vaccine-preventable disease, and then you need to diagnose the drivers and the barriers to immunization, so why are people not vaccinating, to then figure out how you can get people vaccinating. You need to address the underlying issues and design evidence-based interventions to tailor the services to the needs of the group. And finally, in addressing misconceptions, so ECDC have got this great webpage looking specifically at measles vaccination. It's tricky to address misconceptions. There's been scientific research in psychology. It's shown that it's difficult. So, for example, if you're going to write vaccines don't cause autism, you have to firstly talk about the fact that what you're going to say is a myth, and then you need to, so you have an explicit warning before a myth. And then you need an alternative explanation to fill the knowledge gap. And graphics work well, but also you need to use careful language. So you can't use very strong language, otherwise your reader comes out with a higher risk perception of the vaccine. Thank you.